no more late nights for Romans. Police officers are patrolling the city, making sure restaurants and bars close early. Shortened business hours and a cap on the number of people that can be seated together are among new restrictions being imposed by the government in Italy.
These measures will allow us to face this new wave of virus spread that is hitting not just Italy, but the whole of Europe. We cannot waste time. We have to act using all the possible measures to avoid a new total lockdown. The country cannot afford a new stop that would end up seriously harming our economy.
Other countries are also introducing similar precautionary measures. In the UK, Wales has closed down all non-essential businesses and asked residents to stay home for the next 2 weeks. Similar restrictions are expected in Manchester and other parts of the country. Ireland has imposed a countrywide lockdown that is expected to last at least 6 weeks. Restaurants and bars in Belgium have been ordered shut until the end of October. And the French government has declared a state of emergency, limiting social gatherings and the movement of people. Cases are also surging in the US, but authorities there are not shutting down businesses or restricting the movement of people. And that may drive the country's COVID-19 death toll even higher in coming weeks.
Northern Europe will most likely go into various aspects of aggressive social distancing measures, and they'll tamp that down pretty quickly. Unlike the US, where I think the strategy is through fake messaging coming out of the White House Coronavirus Task Force, putting out false claims about herd immunity. Their idea is to just let it go, and that's going to be devastating for the American people.
The World Health Organization says unless governments take urgent steps, the latest surge in COVID-19 cases in Europe and North America could overwhelm healthcare systems.
As the Northern Hemisphere enters winter, we're seeing cases accelerate, particularly in Europe and North America. As cases go up, the number of people needing beds in hospitals and intensive care also increases. Nurses and doctors have a much better understanding of how best to treat people with the virus than they did in the early days of the pandemic. However, when hospital capacity is reached and exceeded, it's a very difficult and dangerous situation for both patients and health workers alike.
Hoping to keep out carriers of the virus, many countries are clamping down on travel to and from Europe and North America. That means fewer visitors and fewer customers, and therefore more trouble for their ailing economies. Mobin Nasir, TRT World.